Hello everyone, welcome to my YouTube channel. And today we're going to find out ways to know if you have diabetes. Before you can find out if you have diabetes, you have to understand what diabetes is. So, what is diabetes? Diabetes is a chronic metabolic disorder that fundamentally alters how the body processes glucose into energy. To break it down, diabetes is a disorder that affects the way your body digests and uses sugar. I'm sure you're wondering how it's possible, or you're still confused. Don't worry, in a few minutes you'll understand everything. So firstly, what happens when you eat sugar? When you eat sugar, digestion starts in the mouth. The moment sugar or food containing sugar enters your mouth, digestion starts due to your saliva. It contains an enzyme called salivary amylase. Now, I'm not going to go through the whole process of how sugar is broken down into glucose. That's a topic for another day. What we're focusing on is what happens after sugar is digested and broken down into glucose. When sugar is digested and broken down into glucose, the body is meant to absorb the glucose. What I mean by absorb is that the glucose is transported to different organs in your body, and those organs absorb the glucose as their form of energy. Now, in the case of a diabetic person, the glucose is not absorbed. Why is that? There is an organ in your body that releases a special hormone called insulin, and the name of that organ is the pancreas. Insulin is very important in the absorption of glucose, and without it, various organs cannot absorb glucose. The glucose remains in your bloodstream, causing all sorts of problems. For diabetic people, the pancreas either stops producing insulin or doesn't produce enough. There are different types of diabetes, but I'm not going to get into that. If you're enjoying the video, like and subscribe, and also comment if you want a separate video on the different types of diabetes. How to know if you have diabetes. But before we get into that, let's go through the signs of a diabetic person. Please, if you have any of these signs, I suggest you visit the hospital for a proper test. The most common signs are polyuria, which means frequent urination, polydipsia, which means excessive thirst, polyphagia, which means extreme hunger, unexplained weight loss, chronic fatigue, blurry vision. Yes, diabetes can also affect your eyesight. Slow healing of wounds, frequent infections. Now, this is one of the most dangerous signs because if it's not taken care of or not noticed on time, the infection might become so bad that the only option is to amputate the affected area.
Other signs are nausea, vomiting, severe abdominal pain, numbness, not the kind caused by staying in one position for a long time, for example, while playing games, but random numbness. Confusion, extreme drowsiness or loss of consciousness, deep, rapid breathing, and lastly, a fruity or sweet odor on the breath. Not from when you just finished eating something sweet, but in the morning when you just wake up. Now, all these are just signs of diabetes. You might have these signs and not have diabetes, or you might have the signs and be pre-diabetic, or in the worst case scenario, you might have these signs and have diabetes. But if you notice any of these signs, please go to the hospital and do a proper test for diabetes. These tests include the blood sugar test, which is the most common and is simple. A tiny sample of your blood is taken, put into a machine, and it tells you the amount of sugar in your blood.
There are two types of blood sugar tests. FBS, fasting blood sugar test. This means you shouldn't consume anything for 8 hours before your blood sample is taken. FBS is normally done very early in the morning, and patients are asked not to eat anything before they come. RBS, random blood sugar test. This means the patient has already eaten before the blood sugar test. The most common test is FBS, because it is more accurate. RBS is mostly done in emergency cases. The normal range of FBS is 70 to 100 milligrams per deciliter. A result of 100 to 125 milligrams per deciliter means you have pre-diabetes, while 126 milligrams per deciliter and above means you have diabetes. Now that I've explained the most common test, other tests include the HbA1c, glycated hemoglobin test, and the oral glucose tolerance test. We've arrived at the end of the video. For more videos like this, like and subscribe.